At Concept Cosmetic Medicine today, we're talking to Dr. Sara. We're going to touch a little bit on ageing process because as we age, we're obviously going to have a change in shape and look and definition to our skin. So for our face, what does that really mean? What kind of things can we expect?
That's right. I think, a lot of people get preoccupied with wrinkles, but often one of the factors that do bother us is volume loss. So sinking, sagging as we age.
Yeah.
And with volume loss, that includes collagen, loss of fat, muscle, bone. Our skull actually shrinks as we age. Wow. So it does look like we have a relative excess of skin.
Okay.
Yeah.
So in order to perhaps not necessarily, turn back time and make us look completely youthful again, but to help us to age more gracefully then in those sort of appearances, what are the sorts of things that we could perhaps look at in order to help create a better shape then as we're aging?
That's right. I think, like you say, the shape is so important. I think I heard one time that someone said you can always tell the age of a woman from across the room, and you're not close enough to see all the wrinkles, but you can see the shape of their face. So in particular, you can see, for example, a nice defined jawline. In this day and age, I think we can do far more non-surgically and minimally invasively. So for example, with fillers, we can do a lot more in terms of adding volume, but also lifting to improve that sagging.
Okay, because I think we've all probably done it at some point where we've sort of stood in the mirror and gone, if I could just do that and just have that slight lift, we might not be so worried about the character lines like your smile lines and so forth. They might not bother us, but it is that kind of fall almost that we get. And I would have thought at some point there was only an offer of going to big surgical change, but you're suggesting now that fillers could be a great alternative to give you a less noticeable change that still takes effect.
That's right. I mean, I do have a lot of patients that come in, they're very nervous of fillers. They've seen the pillow cheeks out there, they've seen the massive blow up lips. They really are very nervous to try it, but I think there's a lot we can do in terms of, like you say, just lifting. It always looks very natural. It's not about just putting as much filler as you can in the cheeks and lips, but turning back time. We want you to look as fresh, as natural as possible, but just more youthful. So I think definitely 5 to 10 years we can improve. Yeah.
That's good to hear. So if we're talking about this area, there is potential to work on that as a lift. What about that jawline? You said that's quite a noticeable area too. Is that a key area we can work with in fillers?
I think it's for me it's right up there in the top three. I think if you're looking at the temple and jawline area, I think can make a massive difference. Okay. It's hard because when we look at ourselves in the mirror, we often don't see face that peripheral. Yes, that's right. We're face on. But if we're looking more peripherally, and often we need a professional to help us with this, that nice defined jawline can really help prevent that sagging, that jowling that many women experience as they age. Yeah.
As a combination though, there's other things that we can do with the fillers too. I guess they all kind of work hand in hand. So what sort of things could you do on top of fillers to create different shape?
Absolutely. I think the fillers aren't a one-stop shop. I think for sure anti-wrinkle injections and skin treatments, in particular lasers and peels, whether it's just the maintenance level or the more makeover level, they all work well together. I think if it's, at the end of the day, if you're just doing small treatments regularly, that's much better way to go than to just do a whole bunch of stuff at once and regret ever having done it and never go back to doing anything again.
Okay, so if anyone's a little bit nervous out there, think I don't really know what to do, they can come and have a consultation at CCM.
Of course, yes. Our doors are open. It's a very non-threatening environment. We can just have a chat. We can. Some people just want to. They have a special event coming on. And they want to do something, but most people are after a bit of a long-term maintenance plan. And That's one of the things that I think we really pride ourselves on, is we do have long-term relationships with our patients.
Yeah.
We don't want people to just come in and do a whole bunch of stuff at once. Like, we want to see them until they're 100.
Yeah, so have that plan in place and you can help them do that, particularly when it comes to things such as fillers, which you're quite passionate about.
I do love fillers.
Yes.
I mean, for sure. I think they do get a bad rap out there, but there's definitely natural ways to be able to do it.
And in the hands of doctors, it's an important thing to have the right person behind you doing it.
For sure. I mean, there's definitely safety concerns are number one.
Yeah.
100%. Yeah.
Excellent. Well, thank you very much for your time chatting about the fillers and all the benefits of reshaping. If you'd like some more information or you'd like to book a consultation with Dr. Sara, you can do so. conceptcosmeticmedicine.com.au.